Paul Ryan was asked a pretty straightforward question about healthcare, and his answer was honest. Completely wrong, but it was honest. So let's watch and then we'll discuss.
Let me ask you something.
Let me ask you this philosophically. Is healthcare a right or a privilege?
Not from the government. So if you say that healthcare is a government-granted right, then we as citizens are giving the government too much power over our lives. If we are saying we want this to be a government-granted right, then we as citizens are saying it is the government who gets to decide where, how, when, and under what circumstances we get health care. That's given the government far too much power over our lives.
So at least he said it, hey, should healthcare be considered a right? No. Not from the government, no. Okay, just to let you know, like if you happen to agree with Paul Ryan on that point, every other modern nation and the overwhelming majority of people within those modern nations laugh at you. Like they think you're a joke of a human. They think you're a ridiculous person, a silly person. Because think about it, when you're crafting a society and you're putting it together and you're trying to be civilized people, we're going to have a government, right? That's just what happens in modern societies. You don't have everybody super fragmented and no social contract. So of course you're going to have a government. The question is, how big is government and what are the functions that it does? Well, when you talk to people in other modern nations, the first thing on the list is, well, obviously healthcare. Like, duh. You don't want anybody going bankrupt because of it or, not getting the care that they need. So to other people in other places, it's like really? This is a question? But at least Paul Ryan was honest. He's like, yeah, no, I don't think that's the case. Okay, so let's dig a little deeper into that. What does that mean? So when you say, no, it's not a right. Okay, so then it's a privilege. So let's go through a few simple questions here. The first question is it moral and just and correct to let people bleed out in the street? So they get into a car accident or something, or they collapse on the street from whatever illness. I'm asking Paul Ryan, is it moral to say, yeah, just let him bleed on the street? What are we going to do? Now, of course, what he would say is, no. Of course. What are you talking about? Yes, you bring him into the hospital, you take care of him, you do whatever you got to do. You stabilize him. I'm not a barbarian. Of course I'm on that page. Okay. So then you move on to the second question. So you bring him in, you take care of him. Is it moral to let people then go bankrupt as a result of that? Now that's where Paul Ryan would have to say, yes. Yes. If somebody gets in a car accident and, we're going to be kind and stabilize you and bring you to the hospital because we're not barbarians. But after that, yeah, I'm fine with you going bankrupt. I'm fine with you, losing everything as a result of an accident. Now, if that also makes you uncomfortable, well, then just say, yeah, I don't agree with that. He shouldn't have to go bankrupt either. In which case, what you're saying is healthcare is a right. That the person should be, if they get hurt, yes, take them to the hospital. And then, yes, take care of them. And don't worry about the money. We'll take care of that. So then healthcare is a right. So do you believe it's a right or do you not believe it's a right? Yeah, dig deeper into what you really believe here. And by the way, it's always, if you think about it in the context of some other person, some other family, people have a weird thing where they, conservatives at least, where they find a way of rationalizing it to make it a moral failing on their part. But if it ever happens to you or your loved one or your family, and you're, oh my God, my wife got in a car accident. She was in between jobs. She didn't have health insurance. Mine didn't cover her. Okay, they took care of her, but now we're going to go bankrupt from these bills. Then you would go, oh, fuck, the liberals were right all along. Maybe instead of our tax dollars, $7 trillion worth going to fight an unnecessary war in Iraq, maybe we should have taken that money and used it for healthcare. Maybe instead of the trillions more in Afghanistan, we should have used it for healthcare. Maybe instead of 54% of discretionary spending going to the military-industrial complex, we should have spent it on healthcare. Maybe instead of the over $15 trillion bailout of Wall Street, we should have taken that money and spent it on healthcare. So, Paul Ryan, at least he's honest, but his answer is just hilariously stupid and immoral. And furthermore, it also just makes no sense from a practical perspective, because he's expressing outrage at the idea of like, no, that's giving the government too much power. If you say that, healthcare's a right, people should get it. But he doesn't make the next logical deduction, which is, okay, well then who are you giving all the power to? You know who he's giving all the power to, right? The private for-profit insurance companies. And by the way, they have an incentive to not want to pay out for your health care. Think about that. Because they make more money, the more they keep the money, pad the bottom line, pay their shareholders. They got to keep their CEO happy, pay for the yacht and the fucking vacation time and the bonus package and all that stuff. So when push comes to shove, only 80% of the money that goes to private health insurance companies goes to actual health care. Only 80%. And it's only that high because Obamacare had a rule that made them spend 80% on actual health care. Sometimes it was like 50-50 pre-Obamacare. How much of Medicare, for example, goes to actual health care? 94%. 80% for private for-profit health insurance companies, 94% for Medicare. So, in other words, more money that goes into Medicare goes to actual care. So that means the government is just factually, empirically, objectively better at paying for your health care than private health insurance companies. So he's saying, don't give the government too much power. But the private health insurance companies have proven that they're worse with that power. They've proven it. It's a fact. So that's the crazy thing. Who are the real death panels? The private health insurance companies. And we have countless examples of this, especially pre-Obamacare. With the rejection for pre-existing conditions and stuff. There was a story of a woman who had acne when she was younger. She didn't put it on her form when she got health insurance. And then when she got cancer later on, they weaseled out of paying for her care because they said, hey, you didn't tell us that you had acne back in the day. She's like, what? It was just acne. They go, no. You say it's acne. We say it's cancerous skin lesions. So therefore, you already had cancer once. It was a pre-existing condition. You didn't tell us, so we're not paying for your cancer treatment today. That's what you get with private health insurance companies. So he's acting like, oh, you don't want to give the government that much power. They might actually be good with it and better with it, like the other modern nations where they are better with it. No, the real death panel and the real people you should be concerned about are the unnecessary for-profit price gouging middleman, the health insurance company, the private health insurance company. But he's got nothing to say about them because they're his donors. So he's a liar. Paul Ryan is. He's a weasel. And most importantly, he's wrong. Ideologically, philosophically. I don't doubt that on some level he actually believes his Ayn Rand level bullshit here. But that's what it is. It's bullshit. And all the evidence suggests he's wrong on this issue. But again, as a final point here, the cherry on top is at least he's being honest and saying, yeah, I don't think it's right. So now it's on the American people to go, wow, you're a callous motherfucker. Think about the real implications of that and then vote accordingly.